we see more coronavirus cases here in Wisconsin and across the country, the need to slow the spread continues to grow. Well, joining me virtually this morning is Dr. Gustavo Ferrer. Good morning to you, doctor.
Good morning.
Well, doctor, you're a former researcher at the World Health Organization and founder of the Cleveland Clinic Cough Center. You've also been running 2 ICUs in Miami, Florida during this pandemic. What has that been like? What are you seeing down there?
Well, definitely in the last 3 to 4 weeks, we have seen a significant increase in the number of cases coming to our ICUs. So after March, April, our ICUs number of COVID cases went down to a handful of them. Today, we are above 100% capacity in our 2 ICUs, and it's a very frightening situation.
It's definitely not the news that we want to hear, but you are also leading research on a possible solution to COVID. Can you tell us what that is, how it works?
Absolutely. We have been developing a nasal spray that happens to be in the market that has excellent antiviral virucidal. It can kill the virus, 99% of the virus, when it's exposed in vitro to cells that are contaminated with the coronavirus. We tested that at Utah State University, and then we tested again at Geneva University. And in both places, it shows that it can kill 99% of the virus within 25 minutes. So we're now heading toward clinical trials. We're leading a multi-center international study where we're going to include people in earlier stage of the infections. And the hope is that we can show that by reducing the number of viruses in the nose, we can reduce the transmission of the disease.
Definitely some hopeful news there. So, doctor, how long might this take if this works even at all, your nasal spray?
Well, we're 3 or 4 months away from having collected the whole data. We're finalizing the ethical part of the protocol, running this to the different ethics committees here in the state. In other countries, they are ahead of us. They are registering patients as we speak today. So the study will be run in 2 or 3 weeks, and then we have about 3 months of, gathering the data, analyzing the results, and publishing the results. So we're hopeful that by the fall, we're going to have some ideas where we are with the spray and the results of the studies.
Okay, so we've got a couple of vaccines in the works, your nasal spray as well. But doctor, as a whole, where do we go as a country until a solution for the coronavirus is widely available, even after that?
That's an excellent question. I believe that all these are tools within the toolbox that we need to put together, beginning with, we know the social distancing work, we know the mask work. So we need to start doing those things right now. As other studies and researchers come up with ideas of reducing the intranasal viral load, we should use those tools while we wait for the vaccine. And once we have the vaccine, I believe that we're going to see results in decreasing the number of cases, but we need to remain watchful because we don't know how the efficacy on the long run of the vaccine is going to be. So all these are tools that we need to keep in our toolbox and use them properly.
Some hopeful news in the race for a cure. Dr. Gustavo Ferrer, thank you so much for joining us this morning and sharing your insight. We appreciate it.
Thank you.